Hello, my name is Molly Prince. I am married with 2 children, ages 9 and 19. I graduated from high school in 1991 and attended East Central College and received an associate's degree in 1994. After being out of school for around 25 years, due to a child with a disability, I have now decided to return and study medical assisting. The topic for my speech is effective communication practices with geriatric patients in a healthcare setting. Today, after listening to my speech, my audience will understand some of the problems that can affect communication and what techniques will help improve them. Some key ways to improve effective communication include expressing understanding and showing compassion. Avoid patronizing. Face the individual, eye contact, asking questions, and above all, listening. Let me start by asking all of you a question. Have you ever left the doctor's office feeling like you were hurried along or no one really listened to your reason for being there? Now imagine being a geriatric individual with possibly multiple ailments and feeling this way. Without effective communication from the medical staff, these individuals could have a potentially serious problem overlooked. A quote from Sir William Osler, dated 1849, states, "The good physician treats the disease. The great physician treats the patient who has the disease." Although many of you are probably not considered a geriatric individual, you may still benefit from some of the ways effective communication practices can be improved. In reality, these techniques should be applied to all patients, not just geriatric. As someone who has a grandmother who recently turned 100 years old, I can say that I have witnessed a lack of communication, effective communication, can produce a negative outcome. Since I am studying medical assisting, this topic in particular is an area that I want to know the appropriate techniques so that I can do my best job. Good, effective communication is an important tool in order to promote successful patient relationships and healthcare outcomes. Communication in general can be more challenging with an older individual. This may be due to age-related impairments, such as memory decline or hearing loss. With aging, an individual's auditory function declines. According to R.E. Mitchell, writer at Gallaudet Research Institute, studies indicate that 16% to 24% of individuals over age 65 have hearing loss. That interferes with communication. Memory loss can also contribute to the challenges. Most memory loss usually starts with subtle symptoms and confusion and can be easily overlooked. According to C.A. Miller, writing for Care and Counseling, dementia adversely affects a patient's receptive and expressive communication. Sometimes when we meet an older individual, we look at their physical appearance and assume they're just old. We won't need to go over everything because they're never going to remember anyway. This is a natural and common practice that occurs far too often. According to R.N. Butler, gerontologist, ageism is the systematic stereotyping of and discrimination against people because they are old. Some suggestions to try to avoid this would be just to get to know your patient, know their history, know their accomplishments. This will help you see them as a unique individual and not a frail old person. These are just some of the challenges when it comes to effective communication. There are ways to help improve our effective skills, keeping in mind that there can be a young 80-year-old or an old 65-year-old, so how you approach will vary. If hearing loss is an issue, be sure to face them so that when you're talking to them so they can read your lips if need be. Do not shout, even though many of us tend to do this naturally when speaking to an older person. It will actually make it more difficult for them to understand you. According to the Division of Geriatric and Gerontology at Cornell, you should minimize background noise and speak slowly, clearly, and in a normal tone. Another good point is to not talk in a baby talk manner. Examples such as sweetie or honey. We can see this as a way of expressing caring. However, this may make them feel disrespected. A better way is to just simply approach them as Mr. or Mrs. Other general tips would include simplify and write down instructions, use charts or pictures, and scheduling early in the day is best. People are typically more alert and the physician's office is usually less busy in the morning. Benefits that you will see when you improve effective communication will be that patients will be more likely to tell you about their symptoms. They are much more likely to follow the physician's instructions, and they are less likely to skip any doses of medication, even due to side effects or cost. Taking time to listen and show compassion can be therapeutic for an individual. Seeing geriatric patients as you see your grandparents, speaking and listening to them as you would want your grandparents to be treated and spoken to is an easy way to approach these techniques. We reviewed how effective communication can be challenging, along with some techniques to improve our skills. I hope some of the examples will be useful now or perhaps in the future. Every one of us have or had grandparents that we care about. The best care and respect is something we should all want for them. In closing, I read a quote that fit my topic appropriately. It's a quote by Gandhi. "A nation's greatness is measured by how we treat its weakest